This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: what is lysosomal storage disease? Answer: lysosomal storage disease is a group of genetic disorders caused by the accumulation of toxic substances in the lysosomes. Question: what is mucopolysaccharidosis? Answer: mucopolysaccharidosis is a subcategory of lysosomal storage diseases that result from the deficiency of lysosomal enzymes responsible for breaking down complex sugars called mucopolysaccharides. Question: what is Hurler syndrome? Answer: Hurler syndrome is a type of mucopolysaccharidosis that is characterized by developmental delay, skeletal abnormalities, airway obstruction, corneal clouding, and hepatosplenomegaly. Question: what is the deficient enzyme in Hurler syndrome? Answer: the deficient enzyme in Hurler syndrome is α-l-iduronidase. Question: what is the accumulated substrate in Hurler syndrome? Answer: the accumulated substrate in Hurler syndrome is heparan sulfate and dermatan sulfate. Question: what is the mode of inheritance in Hurler syndrome? Answer: the mode of inheritance in Hurler syndrome is autosomal recessive. Question: what are the symptoms of Hurler syndrome? Answer: the symptoms of Hurler syndrome include developmental delay, skeletal abnormalities, airway obstruction, corneal clouding, and hepatosplenomegaly. Question: how does Hurler syndrome develop? Answer: Hurler syndrome develops as a result of the deficiency of the α-l-iduronidase enzyme, leading to the accumulation of the substrates heparan sulfate and dermatan sulfate in the body. Question: what is the long-term outlook for individuals with Hurler syndrome? Answer: the long-term outlook for individuals with Hurler syndrome is generally poor, and most affected individuals will not survive past childhood without treatment. Question: what are the treatment options for Hurler syndrome? Answer: the treatment options for Hurler syndrome include enzyme replacement therapy, bone marrow transplantation, and gene therapy. Question: what is enzyme replacement therapy for Hurler syndrome? Answer: enzyme replacement therapy for Hurler syndrome involves the administration of the missing α-l-iduronidase enzyme to help break down the accumulated substrates. Question: how is bone marrow transplantation used to treat Hurler syndrome? Answer: bone marrow transplantation is used to treat Hurler syndrome by providing the patient with a new source of cells that produce the missing α-l-iduronidase enzyme. Question: what is gene therapy for Hurler syndrome? Answer: gene therapy for Hurler syndrome involves the introduction of a functional copy of the missing α-l-iduronidase gene into the patient's cells, allowing them to produce the enzyme and break down the accumulated substrates. Question: is there a cure for Hurler syndrome? Answer: currently, there is no cure for Hurler syndrome, but treatments such as enzyme replacement therapy, bone marrow transplantation, and gene therapy can help manage the symptoms and improve the quality of life for affected individuals. Question: what is the impact of Hurler syndrome on an individual's daily life? Answer: Hurler syndrome can significantly impact an individual's daily life, causing developmental delay, physical disabilities, and a reduced lifespan without treatment. Question: how is Hurler syndrome diagnosed? Answer: Hurler syndrome is diagnosed through a combination of medical history review, physical examination, imaging tests, and laboratory tests such as enzyme assays and genetic testing. Question: can Hurler syndrome be prevented? Answer: Hurler syndrome cannot be prevented as it is a genetic disorder caused by mutations in the IDUA gene. However, carriers of the disease can seek genetic counseling to understand their risk of passing the condition to their offspring. Question: how does Hurler syndrome affect the nervous system? Answer: Hurler syndrome can affect the nervous system by causing developmental delay, cognitive impairments, and central nervous system abnormalities such as hydrocephalus. Question: can Hurler syndrome be treated with dietary changes? Answer: dietary changes alone are not effective in treating Hurler syndrome as it is a genetic disorder caused by a deficiency of the α-l-iduronidase enzyme. However, a well-balanced diet can help support overall health in affected individuals.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.